right. Hi, everyone. Thank you so much for joining us tonight for our amazing panel that we have set up for you all, where we're going to be talking about partners and the community's role in advocacy for Black maternal health. As you all know, this week is Black Maternal Health Week. And thankfully, we had a session last week where I sat with LaToya from founder of Mother, Baby, and Beyond, and we had a chat about, you know, why Black Maternal Health Week? Like, what is the reasoning? So now we're back again, still in Black Maternal Health Week, to talk a little bit about the role of partners in community and advocacy for Black maternal health. And we have an amazing panel of, I mean, I don't know. It's just, I don't want to say Black woman magic, but I mean, like, I'm getting all the feels because it's just a curated space of just brilliance. And I'm going to let everyone introduce themselves, but I had a little sneak peek before we went live and, and heard the background of everyone. And I was like, wow, this is just amazing. So I'm going to lead off and do introductions. We'll start with LaToya. LaToya, if you'd like to introduce yourself.
Sure. Hi, everyone. Thank you so much for taking time to do this conversation. Thank you, Brittany, as always, for just opening the space for these conversations to happen, especially elevating the importance of maternal health and Black maternal health during this week. So my name is LaToya Brathwaite. I am a family nurse practitioner, board certified, and the founder of Mother, Baby, and Beyond, where we really focus on postpartum healthcare and early parenting support. We also work very closely in the community by doing monthly pregnancy and postpartum clinics to take the resources to moms right where they are in the community to get them access to the care that they really need. And on top of that, I'm just a very passionate maternal health advocate, and I'm just honored to be here with Dr. Canty and Lindsay again as well. So I look forward to our conversation.
Same. Thank you so much. And next up, we have Dr. Lucinda Canty.
Yeah, hi everyone, and thank you for having me this evening. I'm a nurse midwife, and this is going to be actually next month is going to be 30 years that I've been in midwifery. So I'm excited about that. I didn't think I would last this long, but I'm grateful. I'm also associate professor at UMass Amherst, and I'm founder of Lucinda's House. It's a maternal health collective that just supports and uplifts Black women throughout their pregnancy journey, childbirth, postpartum, and it's really just about using the resources we already have in our communities to uplift us, but also making sure that together we can work to address structural racism. And I also work with just educating healthcare providers, from nurses, OBs, even those people at the front desk, on how to make sure they create safe environments for us when we show up for care. So I'm looking forward to our discussion today.
Thank you, Dr. Canty. And last up, we have Lindsay Griffin.
Hi, everybody. Brittany, thank you again. I echo what LaToya and Dr. Canty said, just having this space for this conversation, which is so important. So my name is Lindsay Griffin. I'm a licensed clinical social worker here in the state of Delaware. Outside of that, I am a wife. I am a IVF mom of two beautiful boys. I have been working as a therapist now for over 13 years. And my focus practice now is working with those who are trying to conceive, so those experiencing infertility, and those who are also experiencing perinatal or postpartum anxiety or depression. I also am a doctoral candidate. I am pursuing my PhD in social work at Bryn Mawr College, where I also teach a reproductive justice and social work praxis class. And thank you for this invitation. I'm excited for our conversation tonight.
Absolutely. And thank you all just for being here for this conversation. It's so needed. Often, when we think about Black maternal health and all of the different disparities that we as Black women encounter, a lot of times we I mean, I know my initial thought is absolutely the systems that we're all navigating in. But there's a lot of power in community. And one of the things that Black Girl Health Collective focuses on and truly believes in is health and healing through our community. Y'all see my coworker in the back. He's going to be joining us. He'll be dipping in it. Because as moms, we wear so many hats, and we really rely in our I know in times where I've navigated things, I've really been community has carried me through. And so I just wanted to have a conversation about the role that community plays and partners play, specifically in how we look about minimizing or lessening those gaps in health disparities. So I would say, first off, my initial question, and it can be for anyone, is what comes to your mind as when we talk about the role of partners in community and Black maternal health?
I can start.
Sure.
It starts with our history, and we really know, even just going back to slavery, there's always a community around pregnant women and them giving birth. I should say birthing people. The midwife created an environment where the person felt empowered. Even though they didn't know what was going to happen, the midwife knew the circumstance of the time. And if you think about how we go through history, that has always stayed true. Midwives knew what the community needed. I should say what the woman needed, and she depended on the community to support the work because they knew there were limited resources. So people would watch the children, they would cook, men would bring firewood. So we always had that sense of community is really just showing up and protecting without judgment. I talked to a midwife. Who's in her 80s. She since passed, but she told me how if somebody was a teen, they weren't saying who's the father, who's this or that. They would just get together and make sure she had what she needed when that baby came. So when I think about community, I think about people showing up and not expecting anything in return.
No, I appreciate that. Sorry, go ahead, LaToya. Were you about to say something?
Thank you, Dr. Canty, for that. I love that answer. What I was going to say is what it makes me think of is the support structure around the woman, right? And I think that you did a great job of, elaborating on that when we're looking at family and community. And, I think when you're looking at history, when you bring that up, and you look back at the history of even this country, right? And we look at what's happening with the maternal mortality and morbidity rates. And you mentioned midwives. During the time when midwives, and what they call granny midwives were really incorporated in the birthing experience, we saw better outcomes, right? And even now, when we look at today, we have seen that we have better outcomes when midwives are involved, when doulas are involved, when the mother has advocates around her. Right. So, educating the partner about what that looks like to support and advocate for mom, and then really having birth workers that are there that will help elevate that mom's voice. So building up that structure, around mom, we know that we see better outcomes when we have that support structure in place.
Thank you, Dr. Canty and LaToya, for starting us out. I want to draw back to what Dr. Canty was just talking about in terms of like going back and looking at what our history is. And this is something that throughout my classes and articles that I've developed, that I've talked about the importance of history. And we have to recognize community is how we've always operated. And when I'm thinking about from a mental health perspective, like so much now our American culture is geared towards individualism. Like, you're going to be a strong Black woman, we're going to do it by ourselves. And it's like, it's not serving us. And we need to go back to really being a part of community and showing up, as what Dr. Canty said, without expectation for one another. And a person is expecting to have a baby, there's so many changes that are already going on within that person's body. Hormones, you're talking about actual physical changes. You can be fatigue, you're not always necessarily your best self, especially as you get like to the later days of pregnancy. But if you can have a community that you can rely on, that you don't have to be stressed about if you have other kids, like, okay, what am I going to do for dinner? Like, again, that those little things add up for a mental load and can create anxiety where it's not healthy or it's not needed. So anytime we can, as talk about going back to our roots and our history of being a community focused culture, that's going to help and pay off huge dividends for mental health.
Speaking of that, so there were so many nuggets in that, and I absolutely believe in being informed by our past about how we navigate. And I think the answer is absolutely community. I was raised in a community. I was raised in a household of 4 generations. It was my grandmother, my great grandmother, my grandmother, me, and my mom. And so I've always been in a community space. And thinking about showing up without expectations, and the growth of individualism, as you said, Lindsay, regarding like in our Western society. It makes me think about like, when did that change happen? And like, when did that shift happen? Because I've seen so, and I'm also wondering what you all are seeing out there, like in different spaces of your work, right? Like, there was a time when it was like, oh, you're a teen mom, you're pregnant, okay, you're on your own, you got to figure it out. Or when you're 18, you're on your own. And I'm just wondering, like when did that shift change? And then also, like, what are you seeing? Is that still continuing? As a society, are we beginning to shift back to that community, like being held by community? I don't know.
Well, I know the main shift started when we transitioned from home births, because nobody wanted to take care of us. But because of Medicaid, other programs that address maternal health, now everybody wants to take care of us because they wanted to learn off of our bodies. They want to make money off of our bodies. So that shift from the home births to the hospital is where we really lost community. Because just even imagine, the fathers couldn't come in. You couldn't have your children there. Even the midwife couldn't go to the hospital. So that's kind of where the shift, I think, started. And I just feel like now is such a money maker. Even though we don't want to talk about it, but insurance companies dictate a lot of the care and the resources that you even go home with. So I know that was a big piece of it. And it's like once it became like institutionalized, we just lost so much, because that was never our history. And we're in a system that's never designed for us. And we're still fighting. I see a change, but I still see people looking at policies before they provide care. Or is it in the policy, or something bad happens to the mother? And they said, well, we followed all the procedures. But if you followed all the procedures and somebody was harmed, then there's something in that system is wrong. And I think when you are going through something, and I'm saying you have that, whether you have a normal birth or the issue that comes up, you need your family there. And then sometimes you have someone with you the whole time, and they're like, well, did they complete the HIPAA form? And I'm just like, this is my mom. If something's happened to me, tell her. So anyways, you just see now everything is about policy and procedure and making sure that the bill is paid, which is for me unfortunate. And I don't want to take up too much space. So I would like to hear, I know there's other aspects of it, but that's the thing that stands out to me the most.
I appreciate that. Thank you.
I think when I think of what I'm seeing, right, in terms of the support system that are in place in the community, it's really a range. And I think it depends on the culture, right, that, you're looking at the community that moms are from. So what I've found, in my work is it's really important to assess what support structures are in place, right? So like you said, Brittany, where you grew up in a multi-generational household, who is there that will support you, right? And what does that look like? Especially because, when we talk about not showing up without expectations, right? I have found that in some families there are qualifiers, right? Like grandma will watch the baby for mom to go to work, but that's it, right? And the understanding of moms usually need a lot more support than just that, right? Needing that space and that time to debrief, for herself, and what does that look like for educating the entire family and that entire support structure that's around mom. And I think to the point that Dr. Canty brought up, when we look at a lot of these policies and procedures, it so often becomes just checking off a box, right? But we have, in order to assess those support structures in place, we have to sit down with that person, right? And really connect with them individually to understand what support structures they have in place. And I think the other side of that I'm seeing is that the support needs support, right? So, I work with different, organizations where fathers and, fatherhood and the partner space is really elevated, and how partners go through their own, process, and even have their own form of postpartum depression after baby, is born, which a lot of people don't realize. Is a thing. So when you're assessing the support structures around mom, also assessing what support does the caregiver have, does the partner have, and what healthy coping and processing looks like in that space. So I think those are some additional things, right, that need to be considered when we're talking about that support system that's in place around mom.
I appreciate that.
Just to add to what's been said, I'm just also thinking about, again, the role that capitalism plays in a lot of this, unfortunately. And what I mean by that is we're seeing fewer grandparents that are able to, watch the baby while parents are at work because they're still working. They don't have the means or ability to retire to be able to lose that income. And when you see how this is impacting families, they're left with less supports. So there are times where the people that I see and the work that I do will talk about like how it's like a dance of when do they ask like their in-laws for help, or when do they go to their parents to see like, well, can you watch the baby or my kids so my husband and I could go out to, like have a little us time, because it's like go, 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 go when you're talking about like these very young kids that have a lot of needs, and they get drained, and they're like, well, I don't really have anybody. And so it's like I'm trying to talk and say like, where are some other supports? If you are involved with the faith community, are there people that you're connected to there? What are your thoughts on looking up and trying to like hire a professional nanny and like interviewing people? Because you got to have some support somewhere, because if you're the one that's always giving care and trying to do it on your own, you're going to find that you're going to get burnt out at some point. And raising children was really never meant to be like a one or just a two-person job. It's really meant to be a community job.
Oh, sorry, hit the wrong button. I was going to say absolutely. I've experienced that and seen where like it's this dance of like asking for support because you don't want to, overburden or overuse the support that you have in play. And you're absolutely right. Like, because the role of that capitalism plays, a lot of grandparents and community members that would otherwise be retired or available and able to support are actively still working, right? Like they're working all the way up, and not even having like a normal, historically, what we would call, a retirement period, just because capitalism and the need for money and resources. So that absolutely comes to mind. Lucinda, were you about to say something?
Yeah, and for myself, I was only working part-time. And when I started to go back to work, my son was like 3 months. And I also felt that kind of superwoman syndrome. It's like, even though I know I needed to rest, I had a cesarean, but I felt guilty asking for time for myself. But I also found that people were also looking to me to help them with things. And so I did something that was a little sneaky, and I felt guilty for a minute, but I felt like I deserved it. But I asked, because if I say, "Can I have help just so I can have a little me time?" That wasn't gonna fly. So I told my mom I had to leave for work, and my partner, that I had to leave for work to go to a conference. And what I did was I drove over to the next town and just stayed at a hotel for a weekend because I just felt so overwhelmed, and I knew it, and I just felt guilty to say I just need time to rest for me, because they, again, it's like, I'm not going to watch the baby unless you're working or you have something important to do. So I said this was work related. And I did feel guilty for a minute, but it was nice to have like a bubble bath and rest and not have somebody, they see you're tired and they still need help. But I thought I needed that to recharge. And my mom doesn't know that to this day.
If she's on this live, she does know.
But I ended up telling her once, I didn't tell her about that, but I said, people are asking a lot for me and I need help. And my mother was really grateful that I said that I needed help, and it wasn't easy. So then she would take the baby and say, "Go in the back room and rest." And so I realized I should have been a little more, honest. but sometimes you just feel like you have to keep moving, moving, moving. And I needed to realize that a cesarean, even in 3 months, you're not healed. And so I started feeling comfortable asking for help and having more people involved and say, "Don't worry, I got you. I'll bring you some chicken soup, or I'll do this for you." So I think that our system also sets us up to make us sometimes feel like we don't have that community. But I think people sometimes don't want to overstep. They want you to ask. And for me, that helps me to heal physically and mentally.
Yeah. And I was going to say, I appreciate that because I think about my oldest is 14, and I'm thinking about a time when I was so exhausted that I was just like crying. I was like, everything's not working. This is too much. And my mom was like, just give me the baby. Just give me the baby. And like, I passed out. I woke up and I was like, oh, that's what was wrong. Like I was just sleep deprived. Okay, I'm good now.
Yeah.
But again, like in that moment, my mom was there as a support to take my son. And I think about the amount of support that I had when my oldest was really young. And I think about specifically going to a couple of things that you all have touched on regarding mental health, the impact of mental health, right? And like when with parents and birthing people not being able really to have that support of community because their support systems are still actively working, or they're displaced and living in different, and they don't have the same level of community. Like how do we navigate that, like as partners, as like what are you all's thoughts on that?
So I'll start off. I think for me, one thing that I often have been doing recently has been referring folks to this postpartum group, just to give again people a sense of connection. And it's a place where these women women and birthing people get to be nurtured, like, and they can bring their infant. And that's the most beautiful thing, because there are some times where there are different programs that come up, but then the infant is not welcome in the space. And so then it's like, okay, now I want to do this thing, but I have to figure out how I can either arrange it with my partner so my partner can keep the baby, or I need to arrange for a babysitter so I can do this thing. Well, we have to have spaces. I was just saying this earlier. We have to have spaces for birthing people and their families to be showing up. So it's like, okay, birthing person is welcome, but hey, you can bring your kids. So that way you don't have to go through that mental labor of trying to figure out what do you do with them. And it's important for these folks to be able to just have that moment to like breathe. But then also the neat thing about this particular program is that they give information around mental health. What are some strategies that you can do that are not expensive or time consuming. There are things that you can do in the moment. There are things you can do where if you only have 10 minutes of time to yourself, because it's whenever you invest in yourself as a parent, it's not just you that benefits. You matter for one thing, because you're a human, you matter, but it benefits in the ways that you show up in your relationships with your partners, with your children, with the other family members.
Yeah, and I just love that you mentioned that having spaces where the baby can come. I remember my son was quiet, and I remember going to a meeting. It was just a two-person meeting, and the previous person in the position was like, bring the baby. I want to see the baby. And the person left, and someone new came in, and she was like, "Oh, you brought the baby?" And I was like, "This is my last time showing up in this space," because I'm like, the baby is a part of me. I'm a new mom, and so I was offended. And I've always felt that we have to have spaces that babies are going to cry, let them cry. They're going to need to be fed, let them be fed. So when it happened to me, I was like, now I see how it feels. But that's something that's so important, is to feel welcomed with your family, because they're so essential to who we are. So I love that you mentioned that. And it's so important that any amount of time that you spend on yourself is worth it. Even if it's a 5 minute. I had some 10-minute naps, and I woke up feeling like it was the next day. But I felt better. So, and I think, again, it's like we have to not have that feeling so guilty when we do something for ourselves.
Yes, absolutely. Thank you both for your responses. And I, agree completely, right? That connecting to community resources, what is in place in the community, right? In terms of, are there support groups in place? Are there other community resources such as community health workers, right? Brittany, talk about if there are gaps in that family connecting with those resources. There really has been a push over the last couple of years to incorporate community health workers and connect them with families, because these are people from the community that are trusted and trained and educated in the resources. And they are able to connect families to the supports that they need. And then I also think, again, going back to assessing that support structure. And if it is just, mom and partner, or that support structure is really strong, it's really small, right? Taking turns. So you talked, Dr. Canty, you talked about taking a 10-minute nap, right? I look at it as two parts. Number one, the importance of asking for help, which you mentioned, saying like, I need help. I'm really feeling overwhelmed, and understanding that it's okay to say that. And then just saying, I just need 20 minutes. I just need, 15 minutes for you to take the baby so I can go for a walk, or can you take the baby out for a walk so I can lay down? And then, vice versa with the partner, right? When the partner is feeling overwhelmed, and then, mom can step into that space and say, hey, I'll take the baby out and give you a minute, right? So I think that partnership in the raising with whoever is in place as a support system is really, really important. And, again, that comes back to educating, both before, during, and after the pregnancy, of the importance of, those things.
Thank you for lifting that up, LaToya. I actually was thinking about also because Lindsay, you were talking about how you currently are teaching like a reproductive justice class, and one of the rubs that I think I have is that people don't know what they don't know, right? And we have to actively create spaces for people to learn the things. And Black Maternal Health Week is just one small space of like within a larger system of like health disparities affecting our community. And I think about all of the different touch points of like chronic illness and how it may intersect with mental health, right? And like all of those things. And I don't think that we have enough spaces where people understand the toll and kind of that invisible load that we carry every day. Um, and I think even for providers, like I think about creating spaces. Like when I went to college, we had like a history lesson on like, history of I think it was African Americans from 1865. But like my understanding of things like regarding reproductive justice in the framework and like the harms through history did not come from a school. These were things that I learned once I got into my field. So it's like how can we educate our community to help be advocates and better stewards and know all of the things.
Yeah. I appreciate you saying that because that's what made me really excited to bring this course to social workers, like future social workers. And again, it's like social workers are like all different aspects of society. I feel like I've talked to LaToya about it. I'm like, I feel like social workers and nurses are just like, we just naturally go together because much of our training is very similar in terms of like the way that we approach things. And in the spaces that we're working in, a lot of times we're colleagues in so many of these spaces. But to be able to start bringing this knowledge to social workers that I'm like, I wish I would have known
Yeah.
back in 2010, 2011 when I was
Mm-hmm.
going through my program, because like you said, we're highlighting the issues of racial disparities. We're highlighting issues of like different social determinants of health. We're highlighting how structural racism is embedded in these things that are driving these disparate outcomes by looking at like all these different topics around maternal mortality, around environmental justice, around issues around healthcare access and safe housing and food. And so it's been a really neat experience because this is the very first time that I'm teaching it. I'll also be teaching it in the summer, but being able to give social workers this knowledge so that way when they're going out in their careers, they already have that lens primed.
I appreciate that. Thank you.
Yes, I love that because one of the things I learned when I look back at history, because in nursing school, we didn't get a lot of this history, which we're still seeing. Like when you think about pain, when you think about our recovery, it was said that Black women don't feel pain or that we recover quickly after a baby, but that was intentional so that we could go right back to work after we delivered. And also when you think about even the sexual trauma that has happened, don't talk about that. But if you learn that history, when you're that nurse or that provider, you're going to be careful with putting your hands on someone. That's why I love the theme of Black Maternal Health Week. Our bodies belong to us. Because I feel like society tries to set us up like we have no control. So when I talked, especially to young people, I'm like, you go to the doctor, they should not be touching you unless they ask you or they're explaining why they're touching you. I'm a nurse midwife. I don't touch your body unless there's information that I need, but you're giving me permission because there's something that you want assessed. So even as a midwife, I don't put my hands on anyone without their permission. And I think that sometimes that gets lost, that somebody wants to learn off of our bodies. They don't tell us that they're a student. Someone wants to do a procedure and they don't let us know we have an option. So what I've learned is really to make sure that people know you have a right to say no at any moment. And unless it's a life-threatening situation, you can say, give me a moment to think about if I want to do this or not. Because I feel like there's allegedly consent and there's true informed consent. And I just want people to know the basics. And I'll have to say this is that sometimes people are even examined and they don't even know the person's name. And I'm like, if they don't introduce themselves, they don't need to be touching you. So it's just, I always start with, being able to advocate for their body. And when I have the partners involved, I say, you make sure you know what she wants, you protect her because she's focusing on that baby, she's focusing on contractions. Do not let anyone touch her unless they say who they are. Because that's what I feel like when we need that support, we need someone to advocate for us when we can't do it for ourselves.
Exactly.
Number one is you have the right to protect your body. I don't care what they say or how they try to scare you. They cannot do any. They should not be doing anything without your permission.
I appreciate that. Dr. Canty, any other thoughts? I know I kind of I don't want to take up too much space, but I had thoughts about that, the consent and like trauma informed care, and But go ahead, LaToya. I'll pop in after you.
The only thing, yeah, I was just going to say is just really the importance of understanding the history. I love that, you keep bringing that out, Dr. Canty, because for me as well, like you said, in nursing school, we don't learn a lot about this history, right? And especially, the history of how it affects, in Black healthcare in general, not just like maternal care, but like you were mentioning with different chronic diseases and things like that. And the more that I have immersed myself in the history of, there's that trauma informed idea of what happened to you, right? Like not what's wrong with you, but what happened to you, and understanding that our history happened to us, right? And whether it was personal trauma that we experienced or the trauma from years that in a very real sense gets passed down, and how that affects the person that you're seeing, right, that you're providing care to, and the conceptions that may have been passed down, through the family. So, I just really love that idea of how you can't really have a true reproductive justice without an understanding of the history and how did we get here? What were the mistakes that we made? What were the things that we did well? And how can we replicate that to make real change, like in our current time and in the future?
I absolutely appreciate that. It's exactly what I was thinking about. Like we can't. I know there's a Sankofa symbol where you have to go back and fetch it. It's like you have to look at the past to be able to move forward. Um, and I think we can't do that in fidelity unless we commit to it. And I think about like the learnings at like schools and nursing schools. You're taught about how to do the technical thing of care, but you don't know the history, and you have to know the history, especially when you're out working in the community. And a lot of that are those learnings and understandings don't happen unless you're immersed in the community.
I even think of, just to add to that point, so we talk about social determinants of health, and in communities where there are very limited resources, right? But when you look back at the history of maybe racism in that state, and you see where redlining occurred, or you see where, there were mass exodus of, groups of people moving out of communities, and how communities plummeted after that when resources were taken away. Even politically, right? There's so many things that have happened historically that then when we look at communities today, it makes sense when you look back and you see the history of racism, you see what happened with resources being pulled out. So I think in so many other areas, looking at the history helps to explain why we're where we are right now.
So my next question is, in thinking about history, how has it impacted how you all navigate within your practice, knowing what you know, and how has it impacted how you support, your patients and their partners in the communities that they've created?
LaToya, you want to say something?
I'll go. So one of the aspects I think that history, just to the point that we're talking about here with community, what history has shown me when we look at what works well, and I touched on this before, is when everyone is involved, right? When midwives are involved, when doulas are involved, when the partners and the families are brought into the conversation, when that woman or birthing person is empowered, right? So the way that it's impacted my care, I mentioned that we do these pregnancy and postpartum pop-up clinics, right? So looking at the history has told me that we need to go to the community and get the resources in the community. It showed me the importance of collaboration, right? None of us can do it on our own, just like we're teaching that, family and that mother that they can't do it on their own and it takes a village. It also takes a village of us healthcare providers to really truly provide holistic care, because I, as a nurse practitioner, can't address all of the things. Dr. Canty, as a nurse midwife, can't address all of the things. Lindsay, as a social worker, can address all of the things. But if we all do our part and we collaborate with each other, right, we break out of these silos and we partner and collaborate for the well-being of that family, that's where we really, start to see really good outcomes, for that family and that mother. So when I looked at my history and thought about what I wanted to change moving forward, that was that, Brittany, I'm very big on collaboration. So really wanting to get everybody together at the table so that we can move things forward for the good of our
I love that, because for me it was I think they paint this picture like we don't have culture, we don't have history, we were just slaves and that was it. And then, but I want to know more, like, how do we survive during this time? And it was me looking at doing my own research, but realizing that we had resources. We were able to build our own communities. Some people didn't like that, and we know the violence that resulted from that. But really, what we needed to take care of ourselves. And what I found is that's really true for today. A lot of the work I do is in the community involves going to the elders, going to those that are great grandmothers or grandmothers. And what is it that they did to help, what are things that you feel we should be doing during our pregnancy? And having to share that with these younger families. Because I feel like we know how to eat. They act like we don't know how to eat. We know how to take care of our bodies with what we have. We know how to lean on the resources we need, but we also know the barriers. So we can name the barriers. And once we name those barriers, especially structural things, then we work together. How do we get around them? How do we address them? How are we able to still provide the services in our communities? I work a lot with doulas, lactation consultants. I work with other midwives, just people from the community. I work with people who aren't even in the healthcare field, but they come and say, I want to do something to help. And together we put together events, we find out what people need. I'm a Black woman. I don't go into the Black community without saying, what is it you need? I don't show up like I know everything, because I feel like, a lot of times we leave that out, and we're taught to leave that out when we're educated. We're like, you go in, you know everything. They don't know anything. And I found that to not be true. And I found that when I go into the communities, especially when I go even into churches, and people have different resources that they'll bring, what I find is when we work together, it's like a better outcome for the community. People feel wanted. We have the partners show up, and the partners show up and they stay all day. They don't come like when we do a community baby shower. They're like, oh, people just want gifts and they're going to leave. People come, they have a good time, they're eating, we're having fun. People are connecting. I've even seen people don't even know each other, connecting and then becoming friends and sharing stories. I'll share this story really quickly. There was a community baby shower, and a woman was dropped off with her daughter. She was pregnant, but her ride did not, who was supposed to bring her back home, didn't have a car seat. And there was another woman who was like, I got like 3 kids. I only have 2 with me. I got a car seat. And she shared that car seat. So it's like, we were all like trying to figure out, we called Uber. Uber was like, we don't have car seats. So we had to find her, but it was just, she stepped up and just wanted, said, I can help. I know, I've been there. That happened to me. And a little part of you is like, well, maybe I can make it home without a car seat, but deep down it's not right. So to have someone step up and say, here's my car seat, you could take it. I think it's just, and that's why I just say the community is so rich with resources. We have to rely on each other.
I appreciate you saying that. Sorry, Lindsay, go ahead.
Yeah, you're good. I'm taking it all in as well. I'm like, it's such a wealth of knowledge, and it's such an honor to be in this space. But going back to what your question was, Brittany, about like history and how it informs like the practice that I do, like I'm a person, and throughout all of my career, I've always been in a lot of like trauma informed workshops and things like that. And I think we have to be very cognizant of operating from that trauma informed lens whenever you're talking about working with Black and Brown communities, given the level of historical trauma that exists in these places, in these communities. When you're thinking about, again, how Dr. Canty has talked about, like going all the way back to slavery. And I've been getting more and more nerdy, I would say, as I've been going through my program with like looking at like the concept of weathering, how this relates to like allostatic load and epigenetics. So it's like we carry these things, even though people alive and well today are not folks that have necessarily been enslaved. But if you are descendants of that carries in your body. So I always really strive for really making sure that in the clinical work that I do, that I'm trying as much as possible to create a safe environment for people to feel safe with opening up with some of their most vulnerable, thoughts, emotions. Because without that, if I'm going in and trying to do clinical work and a person doesn't feel comfortable talking to me, we're not going to make any headway. And I always tell my folks, like, if I cannot be the person to meet your needs, I will help connect you to somebody else. Again, going back to community and partnership, like, I can't operate in a silo if I want to see the best for my community. I am okay with setting pride aside and saying, I can't do this. And there have been times where I've had certain folks I've worked with where we get to a place I'm like, this is outside of my skill set. I want to make a warm handoff to someone that is going to be able to meet this need and explain why. The other thing that I've been very passionate about in the way that, especially talking about Black women and Black people with the capacity for pregnancy, the way they have been like disenfranchised with regards to information. Like, again, like people are so often think that, I think Dr. Canty was talking about, like, we don't know things. And it's like, that's not okay. So it's like, even recently I was at Dell State University talking to a group of students about the importance of like reproductive health and being able to feel like you can ask questions, going back to what Dr. Canty was talking about, and advocating for knowledge regarding your own body. Because when people have understanding of what's going on with their own body and what needs to be done, they can make informed choices. And again, that all goes back into, again, reproductive justice principles and also trauma informed care principles.
I mean, all of the things. All of the things. Um, wow. I'm just gonna sit with that before I say anything else. Any other thoughts about how your frame and understanding of our history and community has informed how you show up? No? All right, I'll jump in. I was going to say that I absolutely lean into community spaces and learning. And I think that it, like Dr. Canty was speaking about, like, it's our history. It's how that's our community. Black folks is just, everything is done within community. And I I often love when we're able to support those in the community with a warm handoff, like you were saying, Lindsay, instead of just saying, "Hey, here's this list of people you can call," right? Because it means so much more. It's so much more impactful when you can actually know somebody, make a warm connection and say, "Hey, I know so and so at this space. Reach out to them. They'll be able to better support you in your needs." Um, and I think that that is what I want us to get back to, right? Like, especially because there's so many resources and so many things happening in the community. But a lot of that work is siloed. A lot of it is siloed. So,
Yeah, and another piece of that does go with the trauma of just being Black and being female, male as well, but I want to just focus on being Black and female, is that we already have so much coming at us. And Lindsay, you were talking earlier about infertility, and there's so many Black women that suffer from infertility. And to give them a list and say, here, call these places, it's like you call and you got to tell your story. So you're reliving the trauma. So to have someone say, like, I don't refer anyone unless I know them. And because I don't want to refer you and then someone causes harm to you either.
Yeah.
But to take away them and say, this person's going to take care of you, just call them and just make an appointment, that just takes so much pressure off of us. So I just that's one thing. I'm just so glad you mentioned that, because that's one thing that's so important to how we care for ourselves, especially our reproductive bodies, because there's so much that we're still learning. I have women in their 40s and 50s still learning things, but to be able to, for someone to say, you need to see someone here, they're going to take care of you, and then they feel safe in that care. But cutting out all that calling, do you have this insurance? Do you have that? Again, that just delays. As some people say, I'm not calling back. So, and I just feel like it's just so important for us to be able to look out for each other in this space.
Yeah, I think it's also important, just coming back to education. When we talk about, infertility, right, there are so many misconceptions about infertility, and Black women, and these stereotypes where we are hypersexualized and our bodies are hypersexualized, and this idea that, Black women get pregnant easy. And, there are these stereotypical ideas when, in fact, Black women do have a 2 times higher rate of infertility, right? And the importance of educating about that to, any, person in reproductive age, as well as the importance of advocating, right? So when you talk about warm handoffs, it's also not allowing yourself to be brushed off, because there are people that I know have gone through the infertility process and were trying for a long time and just continuing to get poo-pooed by the physician. Oh, just keep trying. Oh, it's fine. And then later down the line, there may have been true medical issues that weren't looked into because they continued to be brushed off. So again, like educating on, no, this is a real thing for us, right? And what does it look like for us to care for ourselves, and how do we speak up for what we need and the care that we need when we don't feel like our voices are being heard?
No, I appreciate that. And how can we support, partners and support people, right? To feel comfortable saying, "Hey, are you sure that you feel okay with this?" When you're in this space, because it is I think we were talking about it last week or in one space about how that is the most vulnerable time of a person's life is when they're giving birth, and things are happening so fast. So I appreciate you all. So we have about, I want to say we have about 7 minutes left. So I just wanted to make space and see if there were any questions from people in the audience, like people that are watching that have any questions for our panelists, or if you all had any final thoughts. But I'm just going to give a second to see if we have any questions coming through. It doesn't look like that we have any questions, but there was a lot of appreciation in the chat earlier. I wanted to tell you all about the belief that it does take a village, and people feeling comfortable about bringing their children and their babies into spaces and being supported by that decision. So we have about 6 minutes left. So I just wanted to see what is the takeaway that you want, those listening today and joining us to take. What are the learnings the one thing that you want people to take away from this space and this conversation?
One thing I could say is just the importance of community. And I would just like to add to what was said today is that we need community to support each other through pregnancy and childbirth and postpartum. We also need that support really anytime in our reproductive lives. And I just really feel like part of that community is being able to talk about sensitive issues like, pregnancy loss, infertility, birth control issues, that we need to have spaces where we can talk among ourselves about what's going on with us. Because I see so many women who think that they're alone. And when they find out that they're not, you see that support kind of come out, and you see that ease and that comfort where they usually internalize and blame themselves. And now they see, I'm not alone, or this happened to this person and they went to get help. So I'm going to go and get help. So we just need to continue to build on, I guess, what is our history and our foundation is the important and value of community. And it's the safest place for a lot of us to be.
I love that. Thank you, Dr. Canty. And I would, piggyback off of that. That would be my takeaway, right? That it's okay to ask for help. That is the biggest thing. It's okay to ask for help. It's okay for the partner to need help, right? I think a lot of times, again, coming back to fathers and partners, they feel unseen in this space, right? So knowing that it's okay to say, hey, I need help too, identifying your support systems, identifying your community, and talking about these things, because when you bring it up, you're surprised, like Dr. Canty mentioned, how many people have been there and they're more than willing to share, but we're walking around with all of this bottled up inside of us, right? So knowing that it's okay to ask for help and leaning into your support.
I love what both of you said. Again, echoing community is key. And it's okay to ask questions. Asking questions to your health providers if you are not feeling comfortable or feeling settled with something, ask questions and don't be afraid to advocate for the person that has reproductive health concerns, whether it is pregnancy or birthing, and for the partner to back up your partner if there are questions or a feeling of unsettledness. Because unfortunately, lives are lost, unfortunately, because of issues of dismissal. And sometimes we have to be okay with getting loud. But definitely community is the most important thing.
I appreciate you all so much for this conversation and taking the time to be here. I know I'm going back and listening to this again because it was so many nuggets. Um, I get the feels, especially about this. This is really important to me. Um, and I appreciate the time that you all took to be here. I appreciate you all listening in the audience to this amazing conversation. And, the work continues and it continues in community. So thank you all. We'll see you next time. Thank you all to our guests. Take care.